Hi friends, welcome back to Complete Medical Coding. It's long time since we have learned few guidelines or learned some questions from the anatomical session. So let's look into the anatomical session. Okay, let's learn few practice questions from the anatomical session. Let's move to the first question. In order to make an intramuscular injection, the needle must pass through several layers of tissue to reach the muscle. Choose the correct order of tissues the needle would need to pass through from superficial to deep. So you already know there are the different layers of the skin, right? Starting from epidermis and ending with the muscle. But what is the correct order, the correct scenario, the correct order of the layers of the skin? That is what is asking. Okay. The correct layers are epidermis, starting from epidermis, then dermis, subcutaneous tissue, investing fascia, and then muscle. So here the correct answer will be option B. Okay, epidermis, dermis, subcutaneous tissue, investing fascia, and muscle. This is the correct order of the layers of the skin for performing the injection. Okay. Now moving on to the next question, second question. During the first day of class, a student lacerated his finger while putting a new blade on his scalpel. The cut penetrated the skin and it was necessary for him to go to the emergency room to have it stitched up. Which layers would the ER physician include in the stitches in order to close only the skin? So here the physician has to close only the skin because of the cut. Okay, the cut which was happened in the class for a student. So you already know the skin layers as we have discussed in the previous question. Okay, so what will be the order in order to close only the skin? That is, the answer is option D. Epidermis, dermis and investing fascia. This much are the outer layer of the skin. Okay, so in order to close only the skin, this is the order of the layers. Epidermis, dermis and investing fascia. Now moving on to the third question. How many regions are in the abdominopelvic cavity? This is a simple question, but it is most commonly coming in almost all the CPC examination. Okay, how many regions are in the abdominopelvic cavity? It is 9. 9 regions. There are 9 regions are there in the abdominopelvic cavity. So the answer is option D, 9. Moving on to the fourth question. In order for a skin abrasion to bleed, the lesion must penetrate at least into the which layer? Okay, so there is any cut or injury and if the skin is bleeding, so in order for the skin to bleed, the lesion must reach until which layer? Dermis. Okay, dermis is the answer, till the second layer of the skin, epidermis and dermis. So answer is option A, dermis. Fifth question. The regionally named layer of tissue which encloses and binds muscle groups together is. So which layer of tissue encloses and binds muscle groups together, all the muscle groups together? That is deep fascia. Okay, answer is option A, deep fascia. So friends, these are few important questions from the anatomical session. I'll be coming back with more and more practice questions from the same. So if you are new to the channel, please support me by subscribing to the channel. And if you like the video, please like and share. And see you in the next episode. Thank you so much. Bye.